Welcome to Lead and Follow, a podcast that explores how great collaboration actually happens. I'm your host, Sharna Fabiano, author of the book Lead and Follow, The Dance of Inspired Teamwork. And I'm pleased to bring you the latest research, insights, and learning methods to help you work together better with the people around you. I help founders, solopreneurs, and new leaders become great at collaborating because I've seen how much more becomes possible when people integrate their ideas, perspectives, and strengths in a practical way. To learn more about coaching with me and for a one-time discount on your first session, go to sharnafabiano.com/coaching and enter the promo code podcast. The link is in the show notes. And now, here's the episode. Today I'm speaking with Erin Barry, Assistant Professor in the Department of Anesthesiology at the Uniformed Services University. She is a health professions education researcher who develops and delivers curriculum and education assessments and conducts research and scholarship related to leadership, followership, and healthcare teams. Additionally, she's a leadership coach with certification from the Kansas Leadership Institute and the Innovative Leadership Institute. Erin has co-authored more than 50 papers and chapters, as well as the book Innovative Leadership for Healthcare. And she is co-founder of the International Leadership Association's Healthcare Leadership Community. She is currently working on her PhD in health professions education, focusing on leadership and followership within healthcare teams, which is what I'm really excited to ask her about today. Erin, welcome to the podcast.
Thank you so much for having me. I'm excited to be here.
I really want to ask you about your research, but for listeners, let's kind of step back. And I wanted to just start by asking you what inspired your interest in followership as a research topic within this context, within healthcare?
It's a great question because a lot of times the focus is always on leadership. And you see that especially within healthcare, a lot of the focus is on leadership, education, and development programs. We're at a military situation and setting. So we talk a lot about what it means to be a leader, but in many cases, you're not always a leader. And in most cases, in fact, you're not a leader. You're going to be following someone. And so what really hit it home for me was when my dad was diagnosed with cancer. He was going through his treatments and the diagnosis and everything. And watching from the outside, it was very interesting to see the dynamics working within those big interprofessional and intraprofessional teams. So there was a lot of things that would happen, with that cancer, lots of things happen. You end up in the emergency room and there would be chaos. He would get 5 different answers from 5 different specialists about what was wrong with him, what the next steps were, and when he would be able to leave the hospital. And it was really frustrating as a patient to sit there and you kind of lose trust in the system of what's happening, who is in charge here, because everyone's giving you all these different answers. And so it really kind of led me to how are we working better in these teams together? We can't always be the leader in these teams. And sometimes we're going to need to step back and take direction from someone else or interject and be that active follower so that we can really be a part of the team and be adding input, but not giving the patient something that is leaving them in confusion and not really wanting to be here and being trusting of the system.
Wow. That's a really powerful experience. And I have a feeling maybe to a lesser degree, many listeners have experienced a little bit of that chaos. It makes me think of like everyone trying to lead at once almost, even
Yes.
with the best of intentions, trying to be helpful, but the end result is what's going on.
Right. Too many cooks in the kitchen. So you need to step back, have a better plan of what you're going to come and talk to the patient about. So it's definitely important. I've seen goods and bads, even being the patient myself or with my kids. Mm-hmm. And it's important. I think it's an important part of the process, especially as we're teaching medical students how to work with other people, whether that's within their team, but also especially with the patients. I think sometimes that gets lost in the medicine in that we're not focused on the person and what they're dealing with in that moment. And so we have to remember that they're part of that team and they're probably following your direction in many situations, but we have to really be aware of how all of us going and talking to them at once, how that's being perceived by them.
I love that. I love the idea of the patient being part of the team.
Absolutely. Yes. Can't forget them. I say them and their families. They are there. I mean, depending on what the situation is, lots of things that, get prescribed and things may not work for them. And so having those conversations is important to realize what is working and what is not.
Yes, totally. And of course, it's a two-way conversation, right? That's what a conversation is. Listeners know it's my favorite metaphor for healthy leading and following. What I also appreciate about your story is how you analyzed the situation, at first anyway, from the perspective of the patient, which we could say is the followership perspective most of the time. And when we do that, we often get really amazing insights and information, which in retrospect then may seem obvious, but they're actually easy to miss when you're only looking from the top, from the leadership perspective. So great pro tip here for listeners. If you're stuck on a problem, if you're not sure how to fix the situation, make sure you're looking at it from both the leadership and the followership perspectives, because often they're very different and they hold different kinds of insights and wisdom. So, Erin, having witnessed on a personal level what happens when there's a lack of coordination, and perhaps we could even say a lack of meaningful followership, what was your research journey like as you began to look for followership in the healthcare literature?
So I think it's really interesting. And I think a great way to put it is we just submitted a paper and it came back as a revised resubmit. And one of the reviewers made the comment that, I've been working in this profession for so many years and I've never heard the term follower. And it was very interesting to hear that because, if you're not a leader, then you're a follower, you're a team member, you're part of this team. And so it was interesting that they wanted the focus to be more on leadership. And there's plenty of papers out on leadership, especially within healthcare. There's lots happening out there, but there's very little about followership. And so what we really tried to look at was where it started in the healthcare teams and where it's kind of heading. So initially, it really focused on that passive follower idea, that people are going to be that blind sheep following exactly what the leader says. And so initially, it didn't really appear within the healthcare literature until about 1993. And once it started, it was an important topic that needed to be discussed. There were much more about commentaries. There were much more perspective pieces. No research was on that part yet. And so it really was interesting to kind of see that it was very much the leader says that this is what's going to happen, and they expect the followers to do exactly what they say. And then kind of looking at healthcare, you can probably see how that has been in the past, that, the physician says something and whoever is on their team doing those things that they need to get done, they follow that without question. And so we've started seeing a lot of change happen over the last few years. And it really started coming into the literature when Robert Kelly started publishing, when Ira Chaleff and Barbara Kellerman really brought a lot of those follower types into the business literature, which then trickled into the healthcare literature. And so all three of them really started focusing on what it means to be a follower. And it's not always being that passive follower. It's much more of an active role, a courageous role. You're trying to be part of that team and to know that you probably have to shift in those roles at many different times, but you need to be a member of that team. And especially in healthcare, when things aren't going right, you have to be willing to step up and say, this isn't right. We need to pause for a moment and step back and have a conversation before proceeding, because we could be talking life and death here. So we really focus on, how can we be active members of that team? And from there, once that started going into the literature, we also started to see a lot more from the interprofessional healthcare space. There was an article to Err is Human that came out. So a lot more talk about working together in those interprofessional spaces. And so that started really tying things together. And it started not really unsiloing, but because leadership and followership are pretty siloed within the literature in healthcare's teams. And so it really started to kind of push that envelope a bit more. And so what we started to find was that there were old ways of thinking about followership. So those passive followers still exist in the literature today, but that's much less so. In many of the cases now, followers are active members of the team. They are contributing. We expect that they're going to be contributing to the team. When something especially is going wrong, they are going to speak up and say something. And so it's finding how we're creating those spaces to really allow followers to step into that role of being an active follower versus just blindly following at orders that they receive.
Such an important progression, right? It just makes you wonder, like, wow, where did that blind obedience come from in the first place? But that's a different conversation.
Right. Yeah. Absolutely.
Yeah, this might be hard to answer, but I'm curious if you've noticed just through observation, like as the thinking has evolved, or, in a room where the thinking is more, I'm an active contributor versus I'm a passive, obey what I'm told. How does that shift the chaos? Like, is there less chaos automatically, or, do less mistakes happen, or does the patient care change? Are there any kind of markers on the ground that you've noticed that indicate like a shift in thinking?
I think there are. I think there's things in place that kind of help that. And I think a lot of the times it's really doing those after action reviews when things go badly. Having that pause and having that conversation within the team of like, hey, here's what happened. Here's what we did well. And here's where we need to improve. And having that open, honest feedback towards each other, all intraprofessionally. We've talked with people who do it interprofessionally as well as intraprofessionally. So sometimes one prefers one over the other because there might be less finger pointing at different things, especially when there've been bad outcomes in different cases. But being able to have that conversation, I think, is really important to figure out what's working and what's not, and being able to listen to all members of the team, no matter what your role is on the team, no matter if you're on day one of the job or we've been here for 30 years. It's important to be able to have that conversation because we have to have that growth mindset. We can constantly be relearning things. There's probably something we can always do better. And so being able to hear that from other people that might have a different perspective, I think really brings that out when we're doing those after action reviews. We see that a lot within the military. And so when we have that crossover of military healthcare, you see it a lot happening, maybe not as often as we'd hope, but it does happen, especially when things have gone wrong.
I wonder if you could clarify for listeners just in this context, inter versus intra, like who are those actors?
So when we talk about interprofessional, we're talking about groups of physicians, nurses, physical therapists, all the different team to include the pharmacists down to the techs, that whole big team of everyone working together, because we're not really focusing on, one profession, because healthcare is a team sport. It's very much all these people are involved in that patient's care. And then when we look at intra-professional, we're looking at the teams of physicians or the teams of nurses. And so a lot of times we see a lot of discussion of how leadership and followership may be shared a bit more in that intra-professional space, because as the attending physician, you might pass leadership down to your interns or to different people on your team, but you're still kind of over there holding on to that leadership position and can step back in if things aren't going right or if they need help in any different situations. So there's a lot of discussion from researchers and from our participants, especially when we're talking to them. They can easily talk about passing leadership and followership between themselves when they talk intra-professionally, but it's much more difficult in the setting to go interprofessionally and pass leadership and followership roles.
Interesting. Any guesses on what might be behind that?
So we are working on different theories of what's happening there. I think a lot of it, though, is it really comes down to the rules and regulations of healthcare. Our physicians are trained and can do certain things. Our nurses are trained and can do certain things. The techs trained can do certain things. And there's a lot of things that there cannot cross over, unless you have gone on and become a nurse practitioner, you cannot prescribe. So being able to have the physician, they're going to write the orders of what medicine is needed. The nurse may know based on their experience, but they cannot write that order. And so it's siloed in a way. It's very sequential when you look at like an operating room situation, that, the followership and the leadership kind of happens depending on where we are. So before the surgery happens, the nurses are in charge of getting that patient ready, making sure the room is all set up, and then it passes to the anesthesiologist. They are in charge of getting the patient into the room and getting them to sleep. Then the surgeon comes in and takes over, and they lead the surgical procedure. Then it might pass back to the anesthesiologist if something happens during surgery, or once the surgery is over, it passes back to them to get the patient waken up. And then we go over and pass back to the nurses when you get into the PACU space. So there's a lot of it changes, but it's very context specific of who is in charge.
Yeah, well, that has some sense to it, actually.
Mm-hmm.
I would say we won't necessarily want to be just fluidly leading and following all the time,
Yes.
when there's very hard skills and, authority in place. So
Yes.
I see that as a good thing. And it's great to keep that in mind, that leading and following exists always on this wide spectrum,
Mm-hmm.
and we need to understand how it's going to benefit us, right, to share those roles or to assign them, where appropriate.
Right.
I want to shift just a little bit, because you do, a lot of your specialty is in learning and education. So having observed this progression of, how followership is slowly becoming a more active role and more valued, how are people learning it, in a healthcare context, or how have you been discovering methods to train followership as a skill, as kind of alongside leadership?
Right. So at our university, it's a big part of our 4-year leadership program. So
Awesome.
We have a leader follower framework that guides our curriculum and our assessment tools. And it is introduced on day 1 of medical school for our students. We talk about followership. We get them to really start thinking about what their dominant style of followership is, so that they can really see that that's probably going to shift depending on the different situation. And so we focus a lot using Barbara Kellerman's model, because it's very simple and easy for them to kind of see that progression on a scale of being engaged or not. Being able to really see that for them, it's very concrete. It's very easy to say, hey, in this situation, I was kind of, a bystander. I really wasn't there involved in it. But over here, I can be an activist. I can really engage in this conversation. I can really kind of help push and influence the rest of the team. And we really talk a lot about, even as a follower, you have much more influence than you might assume. It's really important to recognize the emotional contagion that, we've all been in those situations where one person can bring that whole team down depending on their mood. They can also bring them up. And so being aware that influence you have, if you're aligning or not with the leader, if you agree or disagree with different things that are going on, the way you're portraying yourself can really influence all those other people as a member of the team. And so we really try to focus on that. And it comes up in we do some different field exercises where they go out into a field setting, do a lot of teamwork and really kind of hands-on learning situations. And then during our after action reviews, we talk about followership. Okay, what was happening here? What different types of followers did you see? And what worked? What didn't work? And being aware that, maybe in this situation, being that person just kind of standing off to the side wasn't what the team needed. But maybe in other situations, you did need to stand off. So being aware that our different roles really do need to change depending on what is needed from that team.
I love this. I love that. Well, first of all, it's really exciting that you have a program that on day 1 is like, yes, there's leading and following. It's just, a great model for the country, I think. Yes. And I hope listeners will, really get excited with me about that and take it back to your own institutions. And I want to also underline here the variability that you're training into the teams, where, followership is not one thing, just like leadership isn't one thing. It's inherently relational, it's inherently contextual. And that it just seems so clear when you pair the field exercise with the after action review, where you're like, okay, let's try this, let's experiment with different styles. And then let's, kind of reflect and analyze on what effect that had. It's such an important process to be in, whether you're in healthcare or education or business. Just that process of observing yourself and reflecting with others. Really powerful learning model, and really exciting. Anything else you want to share about that you've noticed as people go through it? Like, how do they react? What sort of feedback are you getting from students?
Yeah, I think it's been really interesting. We also pull a lot from the Kansas Leadership Center. Their basic idea is that leadership is an activity and not a position. So being able to really see that is hard, I think, for some of our students. They've come here, they are joining the military, they have been top of their class, they've been leaders. And then to talk to them that it's not just about being in that position, having that title, it's about the influence you have being a member of that team, can be a hard learning shift for them to really see. So I think sometimes we really have to focus on really framing that for them and having those conversations that this might be hard. This is not always an easy conversation to have, but recognizing that you're not always the leader. And I think that's really important within any context that you're within, whether it's healthcare or whether it's business, you're not always leading. And so getting that reaction, I think, from people is always interesting to hear and see. We have some students that really dig in and love it and are like, this is great. And seeing and jumping in and seeing the value that as a member of the team, you can influence everyone to include the leader themselves. And then you have certain students that will dig in and this isn't for me. I'm not a follower. I'm always a leader. So it's always interesting to kind of watch the different reactions of what's happening within their thought process as well.
Sure. Yeah. And it is a major shift, right? Like a mental shift neurologically and a cultural shift. But that key insight, leadership is an activity, not a position. Likewise, followership is an activity, not a position. That seems to be really, really key, no matter what your context. And this is another really great takeaway, I think, for listeners who might want to start experimenting with this on their own, is that conceptual shift and the need to frame that, for participants. Those students at, any age or, those in the healthcare program who struggle, who are, have maybe learned no, leadership is a position. I really don't want to be a follower. And that's understandable. Like I really understand that, what we call resistance or just aversion, because, it's an identity question. So, how do those folks kind of work their way toward followership over time?
I think it's with experience. I think it's having those things when they don't go as well as you think they do, having a lot of, peer assessments, peer feedback, being able to have that conversation where you think you're doing great and your peers are like, ooh, this is not as good as you thought. So having that, internal, external self-awareness kind of come to a point where it's like, this isn't working. And so I think it really takes those moments of something's happened and there's a dissonance there that really gets people to start thinking like, you're right. I do need to focus on this. I am not the leader and I'm most likely going to be the follower in many situations, especially for our medical students. You go in at entry level, you're not leading. You don't have that positional title, but you do influence other people. And so I think recognizing, again, that influence is key.
Yeah. Thank you. Thank you. And also just pointing out that we learn so much from when things don't go well, and that's inevitable, right? But using that as a learning opportunity, really, really powerful. Any other guidance you have for those who might want to start bringing in followership into their concept of leadership training?
I think the self-reflection part is huge, and being able to, again, having that conversation, but having them reflect. We do some activities in other settings where, reflect on where you're a leader. That one's usually pretty easy and it becomes very positional. You'll kind of see as they list things out of where they've been the leader. And then when you flip it on them, okay, well, where are you a follower? And trying to get them to see that, yes, you're following in many other situations. And then what does that mean? What type of follower are you in those different situations? Is that working? Is that not? Again, we go back to a lot of those, AAR questions, trying to figure out what's working, what isn't, and how are you going to grow from that? Because a lot of times you can have all these different thoughts and things that have happened, but what are you going to do to make yourself better? Make sure you're having that growth mindset to really continue to improve yourself. Because without that, you're going to stay stale and stagnant. It's not going to really improve yourself as a leader, as a follower, as a team member. You're really just going to be what you are. You might get lucky and get certain positions, but it's not going to keep developing you as a person, as a team member to make healthcare teams more effective. So I think that self-reflection, getting people to really understand where their values are, what is their philosophy for leading, for following, what are they expecting, and getting those clear expectations from when they're working in teams. What expectations do we have of each other? Knowing who's doing what so we don't step on toes, we don't cause any issues, but being able to step in and help if someone needs their help. So being able to really understand your role on that team, I think, is key. And reflecting on that can really dig into a lot of different things that are happening. I had one participant yesterday tell me that, she was really grateful to kind of go through our interview process because it was very interesting to talk about followership and really reflect on that. And it was much harder to reflect on what followership means to them, where they've seen it work really well. So it's a different conversation, I think, to have that we don't always have. And so having those moments to be able to reflect, think about what's happening, and really, where are you going next with this information to really help guide yourself to continue to develop.
Great. Yeah. Thank you so much for that. And I think part of why it's hard is we're just not used to it, right? We've been learning about leadership our whole lives. And now suddenly someone says, well, what about followership? And there's this big blank, but that, it just means practice. We need to rehearse the language and talk through it and recognize also that it does change, right? It's so variable. I want to go back a little bit to something you mentioned about emotional contagion and the energy you're bringing into a group, because I think that is something also that's under-recognized and hugely influential. And I wonder if you could talk a little bit about what happens when you're not attentive to that, like what's at stake here, especially in healthcare, where, as you said, it's life and death, and I just think that would be worth sharing a little more about.
It's something that if you can't be self-aware and recognize your actions and your emotions and things that are happening, if you don't have the emotional intelligence to be there, it really can affect different things, your relationships with others, the team as a whole. Because again, if you come into the room and you've had a really terrible day and you just keep being negative and negative, other people, that feeds. And so especially if you're going into a surgery or something, that negative energy can feed to everyone else, and everyone else can take, even if they've come in the best mood they've, ever had, that can still bring them down. And then mistakes can be made because maybe that person is, making sly comments. Maybe they're, trying to be funny, but it's not funny. So it's trying to have those different ways where just being aware of what's happening, noticing like, hey, I'm having a rough day. I'm sorry. Like being able to say that out loud to your team can have a better effect. That, hey, if this is too much, please just tell me. Well, we can talk about this another time. This might not be the time for it. But it requires that self-awareness. And I think without that, you can't continue to adapt. So I think being aware for yourself, having others on your team, being aware of, hey, this is a really negative energy right now. We really need to turn the corner right here. We can't be focused at this. We really need to be focusing over here. Just being able to call it out. Again, creating that psychologically safe space where we can have those hard conversations sometimes to really keep the mood where it needs to be. Because yes, there's going to be surgeries that are going to be difficult. There's going to be teams that you might not always want to work with, but we have to. Sometimes you don't get a choice of who you're going to be working with. So we have to be aware that the way we're acting can impact other people.
It's so true. And I think healthcare is, and imagine a surgery room, right? There's really almost no other higher stake here. And it's important to realize that it's not just about feeling good yourself or feeling bad yourself. Like negativity spread through a group has very concrete impacts, right? You make different decisions, specifically worse decisions. You're less, as you said, can't adapt as well, which is crucial, right? These are very sensitive moments. And we need, correct me if I'm overstating this here, Erin, but we need our full faculties, right? Mental capacities, and those negative emotions actually impair, right, our ability to think clearly and to relate to others, which is what we need to make the fine in the moment decisions.
Yes. 100%.
100%. Yeah. And I mean, it's the same anywhere, but in this context, it's so apparent, and I think it just just want to underline like that, emotional intelligence is not something to be discounted, right? It's really equally as influential as like any other kind of skill.
And it's a skill that can be worked on. So it's not, our personality, it's not our intellect. Emotional intelligence is one of those things that you can continually develop and work on for yourself. And without that, there are studies that show that you're not going to be as an effective leader. You're not going to be as effective on those teams. That it really is a big part of being able to lead, being able to follow, being able to be effective in what you're wanting to do.
Thank you for that clarity. And I would also like to refer listeners to a previous episode of the Lead and Follow podcast with Yolanda Tonette Sanders, who shares her own research on emotional intelligence and followership specifically. Erin, what have I not asked you yet that you'd like to include here from what you're discovering and as a teacher and researcher?
Really just having that conversation, talking about followership, talking about reflecting on what's working and what's not, and really being able to have that self-reflection to figure out where you're going to go. How are you going to grow from your experiences? Because if you're not going to take the moment, and, we're all busy, it's hard to sometimes take those moments and really reflect on what we can do better. And it's hard to, focus on the negative parts, but without that reflection, we're not going to grow. We're not going to be better in different things. So it can start as early as, I talked with my kids about followership all the time. Like, how are you going to be in the classroom? Your teacher is the leader of the classroom. Mm-hmm. How can you influence other people around you to do what needs to be done? When you're talking to like fourth graders, that's not always a parent thing to see. So I think the conversation can start so early. You don't have to wait until, we're leading teams to really figure out what that means, because we're all going to keep working on ourselves. We all want to be better. Mm-hmm. So finding those situations where we can have that conversation to figure out what to do next.
Beautiful. I love that you talk to your kids about followership in the classroom. Yeah, it's awesome. And especially just linking following with influence as much as possible, because we're not used to that. And yes, just sitting there, how are you sitting there in class influencing, everyone else? Fabulous. Well, thank you so much, Erin. This has been delightful and so many great gems that I'll be taking, and I hope listeners will take into their own context, whether they're in healthcare or somewhere else. I can't wait to hear what else materializes from your work, so I'll be following it closely. But all the best, and I look forward to our next conversation.
Thank you. Greatly appreciate it.
You have been listening to the Lead and Follow podcast. Special thanks to Glover Gill for composing our music, and a huge thank you to all of you who support the show. It really means a lot. If you enjoyed this episode, please share it with a friend or consider joining the Lead and Follow fan club for as little as $3 a month. There's a link at the bottom of the show notes.